and welcome back to 90 Seconds Healthcare. Samer Ellahham, cardiologist, quality improvement, and artificial intelligence, digital health interested physician. So when we initiated a few months ago the 90 Seconds Healthcare, we mentioned, I hope clearly, that we will be discussing medical issues, especially in cardiology. We'll be discussing quality improvement and digital health with focus on artificial intelligence all the way to metaverse and others. Today, my focus is on everything and anything, including specifically quality, a topic very dear to me that I've tried to practice, push, discuss, and understand and improve, called patient engagement or person engagement or family, community, patient, and person engagement. So in a prior video, I spoke about the wishes of the persons and the family. So, using the voice of the patient, if we could summarize so many things that the patient wants, we probably can summarize them into 4 important items. Item number 1 is keep me safe. The whole idea of safety obviously is a top priority, and we always say safety first, not only in healthcare, but in general. Heal me. What we mean by this, as you know, is evidence-based medicine. Whatever is updated in the guidelines, what the evidence says we should do, and we do it appropriately. Be kind to me, which basically summarizes the patient experience, the whole idea of care, compassion, and respect. And very importantly, something that's not always discussed is the engagement of the patient, the person, the family, and even the community. So if you think about it, this whole discussion of patient angry, patient unhappy, disengaged, poor compliance, poor adherence, if you look at it carefully, the root cause on many occasions would be related to the engagement of the patient. So let's think about this simplified model of the patient engagement when a caregiver, say a physician or a nurse or others, are communicating with patients and family. And the idea is to involve patient and family in the care as active partner and valued team member. So not only we don't mind spending time and discussing not only with the patient but the family, it is indicated, it is important and extremely helpful to the caregiver, to the institution, to the organization, to standardize, support, and request that patient engagement be a top priority. So the caregiver that hopefully has created in the institution, whether it's a small clinic or a large organization, trust, also showed not only empathy, but care and compassion, which is so important, listening actively in a way that's not only the ears are open, but also the eyes, the eye contact, the body language, seeing the big picture, not just focusing on minor details. While some of them are important, the big picture is key, and understanding things and expressing things at patient level. Patient level doesn't mean that the patient is not educated, especially now with the internet and all of these things. But, simplify to a certain degree while being very accurate and very thorough, and making sure the messages do not have, useless jargons that add absolutely no value to the patient. So while the information here is extremely important, it's the human connection which is sometimes challenging. And again, we need to tell the patient and the family about some, training that we're going to do for them. And the training is simply that each and every visit, the patients are expected, say, to repeat what we said, just to make sure that we gave the message appropriately or we were clear. Tell them about the tool of repeat what I said, and what are the key messages. Because the idea is not simply to tell the patient your potassium is low, your cholesterol is elevated, you have something in the chest x-ray, there is something in the mammogram, but also to remember the human connection. And, some colleagues unintentionally mix up between reality, truth, and compassion. We can still tell the truth and be very realistic, but have a huge compassion. And I'm sure all of us had family members who were involved in something related to healthcare, and we had some very challenging experience with caregivers giving the messages, lack of clarity, and unfortunately, lack of compassion. There are different levels of patient adherence, compliance, and more importantly, the engagement of the patient. This is from a publication talking about patient activation. And in this publication, there are four levels of activation. There is level one, which is a completely disengaged person or patient and family, and completely overwhelmed, totally out, denial, passive. This is not my business. I don't want to talk about it. I don't want to come back even to be seen by any doctor or nurse, etc. Level two is moving a little bit. It's, as you can see, dynamic, becoming aware, but still struggling. So, they know that there is something in the mammogram. They know that there is something in the chest X-ray. They know that the heart is a little bit weak. They know that there is a leak in the valve, etc. But kind of still they are struggling with the idea. And typically there is a lot of denial. Level three is taking actions, which is now we're engaged. So at that level, the patient, the person are becoming more and more engaged in their care, and they are even taking actions. Yes, I'm going to do a biopsy. I'm going to do, bronchoscopy. I'm going to follow up, do other tests on my heart, etc. And level four is maintaining the behavior and even pushing further. So these are increasing levels of activation from passive to engaged to activated. The impact of this, there's a huge amount of literature supporting that this is very good both for the person, the family, the community, the doctor, and the whole healthcare system. There are tools on how to do these things. One of the very simple tool is just to check back, is the message there? So imagine, kind of just to simplify things. And again, maybe you thought about this before. Maybe you know about this as a person, as a family member, as a patient, as a doctor, a nurse, or a caregiver. But let's say that there's a doctor who is giving a message to a patient and saying, your cholesterol is elevated. You have something in the mammogram. There is a lesion in the a nodule in the chest X-ray. Whatever is the topic that's being discussed. It's extremely important to verify that the message went through. And the last thing we want to do is say, hey, is it clear to you what I just said? I hope you got it. Obviously, never ever. If there is anything, never ever. The idea is, I just want to make sure that what I said is clear, because sometimes what I say may not be clear. So we always take accountability that if this is not clear, then we need to do better, us and the healthcare system. One example is transition of care, which is discharge, a crucial time to use check bags and teach bags. And does the patient fully understand actually what we just discussed, and include family members to maximize compliance? The impact, I don't think it takes too much work to intuitively and also scientifically, no time to show you several publications, these to improve the safety, the quality of care, the patient experience, and obviously the engagement. And ask the patient to repeat back their understanding. I will not be exaggerating if I told you I almost do this now all the time. When I was younger, I tried to do it as a resident a few times, but I'll be honest with you, this is something that grew up with me. And when I looked at the literature and I looked at this very important topic, I thought, hey, maybe in social media, we need to tell all about this. For physicians, colleagues, and nurses and others who know this, my encouragement is you and I need to do it even more and more and better and better. For persons and patients and community members, we need to even expect it from the caregiver and also not feel uncomfortable if anyone of our colleagues ask, can you repeat what I just said? The whole idea is to improve communication and also engagement. And this is a video on something very dear to myself. And before I start the video, I try to almost routinely 95% plus to do the handover and even the daily rounds, whether I'm doing consult or ward or rotating on the ICU, as much as I can, I try to do it in the patient room. So please watch this video. So this is about bedside handover, very timely, and you are including people inside and helps in continuity of care patients.
Hi Lisa, I've got bed 14 today. Is she your patient? Yeah, do you want to go do handover? Sure.
So you go to the patient room.
Hello, Mrs.
Or if you
Livingston.
are a patient, you feel good
This
about
is Jackie. She's going to take over from me this afternoon. So is it okay if we come in and do handover?
Yes, thanks.
Is this a family member of yours?
Yeah, it's my sister Sarah.
Okay, are you happy for us to include Sarah in your handover?
Yeah.
How are you feeling today?
Oh, a little sore.
A little sore?
Yeah.
Okay. Mrs. Livingston, do you mind if I check your ID band?
Okay.
So we have Tiffany Livingston 010101. Are you happy for me to call you Tiffany, or would you prefer Mrs. Livingston?
Tiffany would be nice, thanks.
Yeah, no worries.
Okay. So Tiffany came in, she had a melanoma in 2000 and she's had an excision of that lesion in 2000 and breakdown. She's got past history of arthritis and she's a current smoker. Tiffany's for Merkel's.
Yeah.
She's on BD OBS and a daily BSL. We had a fall yesterday.
Tiffany, how did you have your fall yesterday?
My legs gave way and I landed on my bottom.
Was that when you were trying to climb out of the bed?
No, it was whilst I was walking.
Not sure walking. Okay.
When was the pain relief next due? Just so Tiffany knows.
So she had it this morning. Basically, it's just a PRN. Means she can have it whenever she requires. She just needs to use that call bell, and we'll get on top of it for her.
Should I have that before I do anything or just...
Is the pain increasing when you're moving around?
Yeah, it does.
Okay. It might be a good idea then if you feel like you might need to get up and go to the toilet. Okay, Tiffany, that concludes our handover. Is there anything you'd like to add?
Not at this moment, Sarah.
No, I think you've been very helpful. Thanks.
Okay. If you have any other questions, don't hesitate to ask, okay? I'll be back within the hour to check on you, but if you need me sooner, press the call buzzer. If you need to go to the toilet at all?
Not yet.
Okay, you let me know if you need to go before I come back.
Okay, thanks.
Thank you, Tiffany.
Thank you,
Sarah.
Thank you.
So as you can see, some nurses or physicians would say that, oh, it's going to take time. Actually, you know, I've done it. It's the most efficient way to do this. But the example here is obviously two nurses doing the handover, and one is coming on the shift and the other one is leaving. But the same thing is done as you are rounding. We call it care plan in our institution, where we go inside the room ideally with the nurse, physician obviously, and the medical team, and also when available, appropriate, if there is a pharmacist with us, a nutrition, whoever. It really gives confidence. People feel nothing is done behind them. The whole concept of nothing about me without me. Many times they ask, you know, what is this medical term, and we explain. Typically, I don't like start saying things in English if these are speaking other languages than I speak. And if I speak in English and they don't know English, then I try to kind of discuss it in a way that's clear. If they are English speaking, I make absolutely sure that the messages are clear and make sure that they are comfortable. So my topic today was patient engagement, person engagement, community engagement. Please take this seriously. Please, comment, share this video if you find it to be helpful. This is a topic that's growing now in healthcare, and I think it should have been a priority in healthcare years ago. Let's all spread the message of all of us being engaged to improve the healthcare system and keep patient safe. Thank you.